We will be starting in a few minutes. I think we'll give maybe 1 or 2 more minutes for more attendants to join. So you can say hello in the chat, tell us who you are, where you're coming from. You can also already pre-plan and ask questions that you may want to know before we even start, but we'll be monitoring both the Q&A and the chat side of things. But please feel free to tell us who you are and where you're coming from and in the chat. And we'll start in about 2 minutes. And if you so wish, you could also rename yourself and tell us, if it's possible, and tell us which organization your name, where you're from on your name. I see we have Grace from University of Nottingham, as a research fellow. Hi, Grace. Hi, Samuel from Ibadan. We have Emmanuel from APHRC. A lot of CARTA fellows signing in. I can see Jacinta. I see Antene Bellet from Addis Ababa University. Stephen from Maseno University here in Kenya. We have Dr. Ukpe Ajima from Jos, Nigeria. Nice to see all of you signing in. Okay, great. So today, I would, good afternoon and welcome to the third of the CARTA10 webinar series. We have been doing this now for the last month. I think a couple of you have joined in where we had conversations with our founding co-director Alex Eze, with our current co-directors Sharon Fon, as well as Catherine Chobutungi. And in that first webinar, they shared with us their thoughts on where CARTA started and where we're heading. In the second webinar, we had our partners talking about how they've engaged with CARTA over the years and the institutionalization of CARTA. And in this particular one, we're very, very happy to be discussing funding research and research capacity strengthening on the continent with 3 of our funding partners who have supported us over the year. So I'm just going to share my screen. I have great. So in this first session, I'll just quickly introduce CARTA. CARTA was formed in 2008, and it was created mainly to try and address the gap that was being found in terms of an African academy and the capabilities of leading world-class multidisciplinary research from our local African universities. The goal of CARTA was to strengthen the research ecosystem of the African universities and support early career researchers to undertake their doctoral and, in the latter years, their postdoctoral fellowships on the continent, and to become internationally recognized as research leaders, with the hope of finally influencing the society. To commemorate CARTA's 10th anniversary, we have been working to try and get ourselves to understand what we've done well, what we haven't done well, and we've then tried to share with you and share with everyone what we have learned over the 10 years and where we think we can go for the next 10 years. CARTA was projected to be a 20-year program, and so we're halfway. And we hope that by discussing the issues that we have seen over the years, the successes that we've made, the challenges that we've had over the years, it will allow us to reprogram effectively to finish the next 10 years. And in the words from our founding director, Alex Eze, his own words were, we started CARTA and the goal was to create an African-led initiative and work with partners who support our work. So we have gone with the willing a bit. We have 8 universities that we work with on the continent. And these universities have also partnered with northern universities across the globe who have provided us with the capacity to mentor effectively and even share different pedagogies to make what we do more vibrant. So what have we done in the last 10 years? In the 10 years, we have enrolled 230 fellows in the program. Of these fellows, 92 graduates have now finished their PhD, and some of them have gone on to take on CARTA postdoctoral fellowships, but others have also won other competitive international postdoctoral fellowships across the continent and the globe. We're also proud of the publication record. We're currently at slightly over 1,000 peer-reviewed publications. And beyond that, they've had a lot of engagement with non-traditional, non-peer-reviewed journals like The Conversation Africa, The Guardian, and blogs have been written about the research they've been doing over the years. But now today's topic, really, we want to focus on why fund research in Africa, and importantly, why fund the capacity to do the research in Africa. The demand for research in Sub-Saharan Africa, and broadly speaking in all of Africa, has steadily increased over the last 2 decades. And with this demand, there has been investment in quality research, and doctoral training has been one of the areas where we have focused for greater investments in research and capacity strengthening strategies within the region. Why doctoral training? It plays a critical role in building researchers' capacities and increasing the quality of research that is being undertaken within the universities here on the continent. And as a result, we hope with all these investments, African institutions, governments, and development partners who have played a critical role over the years will prioritize and continue investing in research and research capacity strengthening to ensure that the quality and quantity of research on the continent is enough to support what we need on the continent. And why this? Well, we've made a lot of progress in terms of research. In Africa, we still account for less than 1% of the research output. So, we're still looking at the context that we were talking about almost 10 years ago. And yet we still fall, at least that's 12% below the African global population proportion of 12%. So that means there's still a huge gap. We still need to invest a lot. The back of the envelope statistic that has now become the standard of saying we need 1,000 researchers per million. I'm never sure where that came from, but it's become the standard. We're very far from there. I think on the continent, we're well below, I think it's 100 or 400. So we need to do a bit more. So, over the years, our journey has been great. We've had very, very many funding partners who have worked with us in different ways. Our universities themselves, we recently published a paper in terms of their in-kind contribution to CARTA, the staff time, because we don't pay staff time on at the universities. So the supervisors who have contributed to that, the focal points we have within the universities, even that is something that we should value, because without the kind of in-kind contribution our partners have put in, we definitely wouldn't have been able to accomplish it. But today I'm really pleased and happy to introduce and welcome 3 of our panelists from our 3 main funders, the Carnegie Foundation, the Carnegie Corporation, the SIDA, the Swedish SIDA Development Agency, and the African Academy of Sciences through the Alliance for Excellence in Science in Africa program. So I'll start off and allow them to introduce themselves as they tell us what they do within their institutions and why they think CARTA we'll start off with why we think CARTA has been great, and then we'll go on from there. So I'll start off with Andre from Carnegie. Go ahead.
Hey. Hello, everyone. It's morning here. I know it's afternoon for most of you, but good day, I will say. I'm Andrea Johnson. I'm a program officer at Carnegie Corporation of New York. We are a private philanthropy, not a business. I work in the Higher Education and Research in Africa program, and I oversee our work on what we call developing and retaining next generation of African academics. CARTA is, I was reading the CARTA, the October CARTA newsletter kind of thing, today. And looking at some of those pieces, like this, CARTA typifies what we as a funder are hoping to do across the continent. It's training and training well. It's developing new ways that are very grounded in the continent to train. It has the institutional components. Graduates are clearly doing things. It's so interesting to see in all the honors and awards. It's since CARTA's been around for 10 years. Some of the early graduates now are actually moving into mid and senior career status. And so it's just good to see all of that. And so it is, I think, it is one of the models for actually building the research capacity, both at the individual and the institutional level.
Thank you, Andrea. So I'll call upon Maria Teresa. I'll say Maria Teresa, but she'll introduce herself in how she likes being known. Thank you. You need to unmute yourself, Matey.
Yeah, it's okay now. Good afternoon and good morning to some of you. I'm very pleased to be back and take now my leading role in CIDA in support of CARTA. I have been with CARTA in the past. I was away from CIDA for 2 years, and now I came back and reassumed my duties, and CARTA is part of my portfolio. I am a senior research advisor at CIDA, and I have been in the past, before I left 2 years ago, the person that coordinated the support that CIDA provides to research for health. Now, upon my return, I will be coordinating issues of global health and climate change, nutrition, and sustainable development. I have to put forward a program for that. So, and I will just say that we like very much CARTA program. From the beginning, CIDA started to support CARTA because it aligns with the 3 objectives of CIDA, that is research capacity in, by, and for low-income countries. And the support that we started to give to CARTA was seen as a proof of concept of research capacity strengthening within Africa and for Africa. The recognition and demonstration that cooperation between institutions providing the best they can give and together have a better result than the addition of its individual components is of great value. Results obtained so far are excellent and demonstrated the great value that as a model of research capacity strengthening, as judged by what you have just shown, Evelyn, and lately about the capacity of postdocs to get funding and become more independent. In addition, we see as a very big value the embedding of the concept of CARTA across participating institutions that will hopefully lead to more transformation of the research environment within the region. We are very, I wouldn't say proud, but we like very much the gender aspects of CARTA program because they have a structured gender, they have addressed gender issues in a structural way. And it's a model nowadays to be emulated across other institutions and policies. And we see that investing in African women is the norm, and in the informal sector, in the healthcare, in the production of crafts and arts, in water and environment, in which women play a very central role. We see now that what CARTA represents in terms of what is happening with the COVID and the post-COVID, I think CARTA it can take a leading position in the demonstration of the possibilities to carry out education with a blended learning approach as a new normal for education that could reach a high number of students, much needed across the continent.
Thank you.
Over.
Thank you, Matey. I'll come back to you on that blended learning in a bit, but I'll invite Alphonsus to introduce himself and tell us a bit about himself as well as his role in partnering with CARTA.
Hi, everyone. It's my pleasure to be here, and thanks to Evelyn and her colleagues for inviting me. My name is Alphonsus Neba. I'm the Deputy Director for Programs at the African Academy of Sciences, and I also double as a Program Manager for one of our major programs at the Academy called Deltas. Perhaps a bit about the Academy. It's a continental Academy of Sciences the only one that draws individual memberships from the professoriate across the continent. There are about 500 members or fellows of the academy. The mandate is to, the vision of the academy, let me start with that, is to transform lives through science. And then we have a tripartite mandate, which falls under three categories, that's tripartite. So we have recognizing excellence as one through our fellowship schemes and through some prizes that we give. We also assist African governments to develop policies and strategies in science. And then in a major aspect, we implement STI programs through the Alliance for Accelerating Excellence in Science in Africa. CARTA has been our partner for the past couple of years. And I think what I like about this partnership is that CARTA, through its program, the program objectives and some of the things that they implement, like the JAZZ series and the institutionalizing CARTA innovations within African institutions. I think through this arrangement, CARTA actually challenges the conventional wisdom on the continent when it comes to providing quality postdoctoral training on the continent. And I think that's very, very unique in the sense that at the end of it all, we have institutions that have quality research trainers that remain in the institutions and don't have to look for jobs or emigrate to Europe and America. And then at the same time, we end up with institutions that are very highly strengthened in terms of resources and an environment in which to conduct research. Let me end here, Evelyn, and thank you once more.
Okay, great. As I mentioned, everyone, if you would like to ask questions, please put them in the chat and we'll be monitoring them and taking them as we go along. So we're going to shift gears a bit away from CARTA, really, just to start more broadly and ask the question around what, as funders, what you think the funding landscape right now looks like. You know, Mete, you mentioned COVID and things are shifting very, very quickly. And of course, the question in everyone's mind is research still, funding research still relevant? You know, I throw that as a bit of a controversy, but because it's pegged to capacity strengthening, the question for me is, what does the landscape look like for research and doctoral training in Africa at the moment? So Andrea, do you want to go first on that one?
Yeah, I think you've hit on it, Evelyn, that, you know, what might have been before COVID and what will happen after COVID are conceivably very different. And so, and it's, I think at this stage, it's quite difficult to project what might be. I mean, I think, you know, there may be debates around how relevant research is given everything else, but certainly in some fields of research, there's still plenty of activity. I mean, around the health research agendas and things like that. I think around, you know, around the problems that the pandemic have highlighted, around food security, for example. I think there will be more potentially interest. I think what may happen in the future is that, and we've always seen this as a trend, that applied research will always take precedence over basic research. That you know, research that has sort of immediate applicability in the health sector, the agriculture sector, the science, technology, innovation sector, which has always taken some priority, these trends will continue. I don't doubt. I think the wild card is how much money will be available, you know, given the uncertainties in economies. I don't know how friendly the environment's, you know, going to be for new researchers, but I do think the challenge will be to look at not necessarily making your research a vocational exercise so much, but rather looking at and being able to explain why it matters that we know this, that I am researching. I think that's always been the case, but it's going to be even more the case now. I think this will be a global kind of an issue, and certainly, we've seen for a very long time, we at Carnegie working in the higher education sector, that certainly in the United States, academic employment has become more and more precarious. That there are fewer and fewer permanent positions in universities, and as to the topic of our discussion today, the postdoctoral. Here, we use primarily the model of the postdoc as a job, and more people are becoming almost permanent postdocs. They move around because they don't have the permanent jobs to go into. Africa's not there yet in most cases, I think, where so many is, and certainly in the CARTA network, and as Alphonsus mentioned, that most of the CARTA beneficiaries, or many of them, are already with academic appointments, and so they don't have to worry about finding a job, but their challenges are different. How do I build a research career on top of my teaching responsibilities and whatnot? I don't think that's going to change either anytime soon. I'll stop there.
I will follow up on some points before I come to you, Métis, because you mentioned applied research and focusing on innovation. But I always ask myself, being a basic scientist myself at some point, is how much innovation can we push in terms of application without thinking about the beginning, and I think the pandemic has really exposed us to a couple of things, that if we're not locally innovating and even applying ourselves in terms of physical innovations, we're in a scenario where the big countries that produce need what they're producing for themselves. So then we're left in the vaccine conversation has been, okay, who will get it first? Is it Africa? If we don't produce it, are we going to be a priority? And those are the things that I keep asking myself. If we continue focusing on applied research, and I'll let you table that one and think about it as I go to Métis on her point in terms of the funding landscape. But I would like to challenge you a bit on that point of why focus on fully applied research when we know the pandemic has actually exposed us as the low and middle income countries to the fact that we may be at the bottom of the food chain if we're not in the production line ourselves. Métis?
Thank you, Evelyn. I will just do a small comment to what you have just said. I think COVID has exposed many faults all over the world, in all systems, in all countries, north, south, east, and west. Okay, in terms of the landscape for doctoral training all over the world, I think there is, SIDA for 45 years has been thinking that, and he was one of the first in thinking that countries cannot do without homegrown capacity in scientific research and technology and know-how. And I think nowadays a nation wealth depends on, to large extent, to the knowledge it accrues and how it applies it, rather than the sources it controls. And the haves and the have-nots will increasingly become synonymous with the knowns and knows not. I think postdoctoral period is a very critical period all over the world, and it support varies very much across continents. But it's the moment in which you decide whether you pursue a scientific career, or what you are going to achieve your goal, you want to continue research or not, and the decisions that you take there have a very big impact in the research system as a whole. And of course, despite an increased number of postdoctoral fellowships across the world, there are very few opportunities for individuals that do not go at the same pace at which PhDs are produced. So we need to consider that more PhDs are produced more than the system can accommodate for postdoc. You are 50 years old or 45 years old when you get a permanent position. In between, you are a postdoc or senior researcher, but still you are very. So I think that in order to comment the question of how the things look like, I will just comment that in 2016, the Science Europe made an analysis of the opportunities for those postdocs in Europe. And I think in order to keep the right workers in the academic system, a research career has to be attractive. And I will call on the things that this study of across Europe pointed out, and is that a grant is often regarded as the most important career boosting factor at that stage. Hosting institutions and granting councils share the responsibilities for the postdoc that they fund. Granting organizations are increasingly demanding for employees a high degree of commitment and a career development plan for these researchers, giving support to career development measures. So we funders, we continually ask more to organizations, what are your plans for these people that we are supporting, how you are going to employ them. And host institutions ought to provide good working conditions for the researchers in order to make a research career attractive. Another thing that came out is that there is a growing concern that the early career researchers risk becoming a source of cheap labor, as Andrea just mentioned, and without a stable employment. Another thing that came further is that very little attention is given to how to prepare postdocs for post outside academia. And this is a very increasing problem. I mean, it's like you are educated, you make your PhD and you are supposed to continue in academia. No, that should not be the case. We need to look at about other positions, other ways to come after you make your PhD. And the other thing is that I already mentioned that the permanent positions are not growing at the same pace, and then we need to and then funders have to cooperate in a more systematic way to find ways and of a comprehensive approach to support career development. Well, how does it look in Africa? I mean, what we know, there are very few opportunities. There is uneven in terms of the very focus in some countries or in some areas of Africa, particularly East Africa, mainly Anglo-speaking countries, great gender disparities that perpetrate the disparities already existing in the tertiary education. I will stop here.
I like the point you brought out in terms of post-outside academia. Of course, that in itself is a huge gap on the continent because we're still building research as a field in general. So we're not even looking beyond academia to think about what PhDs can do going forward. But I think that's something we'll pick up on later. But there's also another point you've raised, Meta, which is quite interesting. And I would want to hear later from you in terms of the focus on Anglo-Africa, not necessarily looking carefully and critically about the Franco and Lusophone areas and seeing how best we can develop similarly and in the same trajectory as here in Africa. But maybe Alphonsus, you and I are probably an example of post-outside academia for those who are holding PhD. So as you look at the funding landscape and address that, I know the Academy have also been thinking about that point, but we keep getting asked that. I keep getting asked that question, and I'm sure Alphonsus, you're the same. You did your PhD, but you're not in the lab. For me, and everyone keeps asking that question. What are the opportunities? We'll pick that up, but maybe you can speak to it as you talk about the funding landscape across Africa.
Okay, thank you very much, Evelyn. I think there are various ways, various angles or perspectives that one could look at the funding landscape for postdoctoral training on the continent. So, for instance, if we think of what happens within funding organizations and what they think, of course, that affects what eventually gets on the ground on the continent and even in countries that are outside the continent. So, for instance, sometimes some of the things that funders are interested in funding would be issues based. So once that issue has been dealt with or is no longer generating the level of interest globally on the continent and stuff, it's highly likely that may actually get on the back burner. There are also times that funders may be interested in specific populations for various types of reasons. And then, of course, we live in an evolving world. So funders' strategies and priorities, they do change. So once they change, this would also affect the level of funding that may be available for funding postdoctoral training on the continent. there's also the issue of geographic focus. You know, we talk most of the times on the continent about colonial alliances. You know, you have France and Francophone African countries. So France would want to focus its funding of funding agencies that are based in France, and the Francophonie as a whole, they want to focus on that. Then, of course, other issues would be funder challenges. So sometimes there's just not enough money within funding agencies to be able to go around and deal with the massive problem that we face on the continent in terms of the oversupply of potential students that we want to pursue postdoctoral studies. And then increasingly, I think we also see that a lot of funders are collaborating with each other in order to do something or fund particular programs, be it postdoctoral or not, and do that in a more efficient manner. Now, the other aspect that or other perspective that we could look at would be what is on the ground, so that we need to direct funding in order to address. So you start looking at on the continent where specific institutions are always winning large grants. So they are excellent. They have reached a particular level of excellence that they are highly competitive. But they are highly competitive at the detriment of many other countries across the continent. And therefore, increasingly, I think amongst funders, there's this whole concept of balancing excellence with equity. So you want a situation where if a South African university like the University of Cape Town is highly competitive and you want to issue a call and want other institutions on the continent to be able to benefit from that call, then you can design the call such that the University of Cape Town and other strong universities on the continent or research institutions are compelled to partner with weaker institutions in order to apply for the grant, such that when they succeed, some of the skills and expertise within those strong institutions can filter through and improve the research environment and training for postdoctoral students within weaker institutions. We also have other issues that are very, very important. So if we look at another thing that's very, very important, I think there's also been an increasing level of confidence within African institutions to be able to manage funds. I think previously, Andrea we have a bit of thing that we talked with Carnegie that affected the AS many years ago, but I think there's also been an awareness that as research institutions, if you promote good governance, be it financial governance or just being able to manage grants in a way and have all the policies in place and be able to implement and monitor those policies and just provide a very conducive environment for managing grants, then that institution would be very, very receptive to funding agencies and would be able to generate much more funding in terms of success in grantsmanship to fund postdoctoral studies. I also hasten to say other areas would be things like the fact that some areas are neglected. So if we take, for instance, social sciences, we don't have many postdoctoral training programs and capacity strengthening programs across the continent in the social sciences, humanities, and the arts. And I think, but then if you look at the lower levels where Africans get bachelor's degrees and master's degrees, you find out that the ratio of those Africans who get first degrees in these fields is very, very high compared to those that get in the sciences. I think Andrea and Teresa, they've already talked about career pathways, which is something very, very important that I think going forward, one needs to really think through. The CARTA model is a very good one, but are there other models where we can ensure that when we train postdoctoral students on the continent, they get assured of jobs or are able to create jobs for themselves like you mentioned, not only in the sciences or in the research arena, but maybe in funding agencies or in policy and stuff? Are we able to work with other interested parties on the continent, maybe governments or maybe NGOs or whoever, to make sure that this actually happens? My last comment would be around COVID. Of course, COVID just blew us all from our comfort zones. You can look at COVID as far as research and training is concerned, maybe in different dimensions. So one, COVID has actually reduced funding flows because most governments are unable to receive the amount of income that they received prior to COVID. The other way, that means there will be limited funding, and a lot of other funding agencies and governments, they are reprioritizing their programs and maybe funding priorities in order because of the limited funding from COVID. The flip side is most of the research that was programmed or the funding that had already been committed because of COVID, a lot of those programs could also not be implemented. So we're actually seeing that there's a lot of surplus money flying around, and I think most funders are trying to negotiate with the grant recipients to see what they could do to salvage the situation. Then my last comment is about perhaps what I'm doing at the academy with a PhD. I suppose yourself and myself and many of my colleagues within the academy, I think almost about 8 to 10 of them with PhDs, I think we actually are showing that having a PhD does not necessarily mean that you remain within the research field. Research, there's a broad spectrum of activities that fit into research, and I think we could all participate in one way or the other in order to make sure that we strengthen our systems and produce the high quality postdoctoral graduates on the continent. Let me end here for now.
Thank you, Alphonsus. I'll pick up on a point that maybe Andrea will speak to. Is we've been talking about the postdoctoral experience. You get your PhD, and actually many of the institutions within CARTA are only just starting to think about the postdoc, the classical postdocs. As you mentioned, Matim, many of us, of our fellows, have permanent positions in the university, so they can go back, and now it's the question of how do you balance research versus teaching, and I think for us it has been how do you encourage that within the university? How do you encourage the postdoctoral environment that allows for research? And I don't know whether within your the evaluations that you've been doing across the programs you've been funding in the continent, whether there's something there. Are there indicators we should be tracking? Are there ways of incentivizing universities to actually start creating this space? Because we're not in that space of a problem where the postdoc is a job yet, because it actually hasn't been embedded and become a position that is really well grounded within the university. Or should we? Maybe we shouldn't be focusing on ensuring postdoc is a position within our universities. Andrea, do you want to take?
Okay, I'm of the opinion that the situations are always evolving. What you see happening now isn't necessarily going to be the case later on. We at Carnegie have prioritized the academics in universities, in part because we built our program around higher education. We've been funding in the higher education space directly since 2000, so for 20 years now. And so our lens is strengthening universities through interventions that in part strengthen people, but also strengthen the mechanisms in universities to be able to continue to produce PhDs, bachelor's, master's, PhDs. I mean, that's what they're there to do, plus the research that nations need and the service component. And so that's who we're looking at. And you don't always, I think there's a tendency to say, all right, this is what a postdoc is. because that's what happens in the US or Canada or Europe. This is what a postdoc is, so this is what we have to do. But that's not, as you said, the universities that may not be what they need right now. Research institutes, yes, you could, bring somebody in as a postdoctoral researcher to work on a research project. Everybody needs a contract position. It's there for however many years until the grant ends, basically, and then they move on to something else. In a university, though, where the teaching function has been but for public universities, the government's interest may be on access to bachelor's degrees, not so much the research. You have a different kind of situation, and so you have to innovate. It's the classic situation where innovation is needed, because the old ways or the accepted ways are not going to work. And so I would not worry about our universities ring fencing postdoctoral positions. I would worry more about, and this is the challenge that we set to our grantees, our partners, that we had been funding for doctoral training. What is next for your graduates? Look at who they are, where they work, what field they're in. If the question becomes, how do you strengthen their research capacity? How do you keep them research active? What is it that they need? And design programs around that, rather than take somebody else's model and just dump it in. So, that would be my, my assessment of what we may be seeing on the ground with external funding, but also what the universities may want to do. And we've seen some very interesting models come up based on university priorities. And then, how do we retain these people? Because that's where the retention comes in. Developing academics, that could be doctoral training. It can be done in many different ways. Retaining is the big problem. And I see a question in the chat. Are CARTA trainees retained in Africa? And I think you would have the actual data, but my impression is that most of them are. And that the programming, the postdoctoral support programming that CARTA offers is helping them in different ways to build careers in the continent, as opposed to having them have to leave.
And I'll just pick up on that point. CARTA focused really on faculty within universities, and our theory of change is that if you focus on someone who's already there, the likelihood of them staying is higher. We are definitely seeing a lot more retention. I think, and Marta, maybe you can type in the chat, is we're definitely seeing a lot more retention than I think you'd normally see. We may have seen a few of our fellows move to different institutions within Africa, but very few of our fellows have actually gone abroad. So I think there's something there. There's something that we can actually tease out in terms of, and actually say, yeah, training people who are already faculty within university actually we get them retained. We do provide postdocs and opportunities for them to go for internships and training abroad, but with the intention of bringing them back, with the intention of ensuring that they get the skills they need to act, and also the mentors they may need that they may not find locally. Because one of the issues that you have in retention is, people don't have the right mentorship at home. So they go seeking it in the area of interest. But if we can find a way of getting that without necessarily sending people away and then they settle outside, I think we're finding that there's utility in that model. But maybe, Alphonsus, I'll ask you to pick up that point that Andrea stated that a postdoc is not necessarily what we as Africa in academia would need. But I know at the African Academy of Sciences, the Deltas program is definitely thinking very strongly about how do you improve the postdoctoral experience. So not necessarily creating postdocs, but really the experience to ensure that we build research capacity. So I don't know what your thinking is in that space. Should we be pushing more in terms of asking universities to create that particular position, or should we actually just say, okay, as long as we enhance research within the universities, then we retain postdoctoral fellows who are capable of undertaking research rather than creating that position? Alphonsus?
Yes, I would think that the place of postdoctoral studies on the continent, it's very, very important. We just can't do without it if we are to build our capacity to do a lot of things on the continent. You did mention about the stat that talks about a number of PhDs per 1,000 inhabitants and how low we are. I think the figure is actually below 200, if I remember correctly. But then the postdoctoral experience actually gives that opportunity to build on the PhD and give and then have that opportunity again to move into research leadership. So I think it's very, very important. And then about our experience at the academy, we've done quite a number of things. We have several postdoctoral training programs that are running. We find out that what we offer is just the tip of the iceberg in terms of need. So which tells you that there is a lot of interest on the continent and a lot of pipeline for potential PhD holders who want the postdoctoral experience. To make that more valuable, we have designed a mentorship program that actually brings together seasoned researchers and mentors from across the world and on the continent, and we pair them up with our postdocs, postdoctoral fellows, and even PhDs to make sure that they understand what mentorship is all about. So they are mentored and they can mentor. They also have peer mentorship levels within this particular program, and the whole idea is that it takes many years to actually come up with excellent research leaders on the continent. And believe me, there are not a lot of them on the continent, and therefore they need to have this intervention is very, very important. Even things like supervision training, I think CARTA is very, very good on doing the supervision training. And you find out that even the senior researchers that we count on them to lead in terms of supervision and mentorship, they themselves have never really sat through a formal training program as far as supervision and mentorship is concerned. So I believe that there is a very, very strong need for postdoctoral training on the continent. We are not meeting it in any way. We're making progress gradually, and with support from other funding partners, like we did mention about collaboration as part of the funding landscape. We are joining hands together to roll out more postdoctoral training programs. Maybe just to end on this, one of the Delta's Africa programs had an opportunity for that they wanted to recruit. I think they had spaces for 20 fellows who had first-class degrees to join the program. In Kenya, you won't believe that about 1,500 students in Kenya applied for that opportunity, and about 750 of them had first-class degrees on the continent. So that tells that as a continent, as funders, as governments, as the private sector, we still have a lot to do if we were ever to use research as one of the interventions. That's research leadership, training postdocs, and having research leaders emerging, if we're to use this as an intervention to help us deal with a lot of the problems that we face as a continent.
Okay, great, thank you, Alphonsus. I was just wondering, Mete, your take on that, because I was just thinking, I was trying to reflect on who actually, or all three of you, are funding postdocs in one way or the other, but whether that's the model that we have put in place is you either do it at home, you get a small grant and you get mentorship, or we struggled to get people to take the postdocs that were elsewhere, actually, because they had been away for their PhDs and needed to go back. So there's that element of our worry was people needed to go back to the universities, so they needed something at home. but actually we thought the postdoc away from home was going to give the skills and the ability to do more when they go back. So Maria, do you have thoughts on that element of postdocs? Is this in terms of CEDA, are you thinking about postdoctoral training, especially within higher education, as one way Africa should be thinking? Or should we actually start saying, okay, let's just focus on the research within universities, and the capacity will be built and the protected time for research will happen, you know, without us being very prescriptive about. Mate, you're on mute. You're muted.
Thank you, Evelyn. Do you hear me now? Yes. Okay. No, I think that. Thank you. Thank you. I think I am on the same wavelength as Andrea in terms that our point of view. I mean, if we do an analysis of what the continent needs, there are two different needs that have to be fulfilled. On one hand, you need to improve your higher education. And research and PhD is a way of improving higher education. And from the beginning, Sweden, many years back, Sweden was looking at building a cohort of PhDs with an intention of having this improve higher education in it. We are drifting, but we are coming back. Our new strategy probably will touch on issues of higher education as well. Andrea is more an expert on that issue, but you have to see that there are, on one side, you need to improve your education system, your tertiary education system. On the other hand, you need to improve your scientific capacity. We don't see PhDs from the beginning. We didn't see PhDs. I mean, the fact that you and our friend now, whose name I just forgot, Alphonse, and me, I mean, I am my PhD as well, and we are doing things that we are not in the lab at the time. I mean, to get the PhD is a way to improve your capacity to analyze things, and to have a person that have an analytical capacity that can look at the same time 2 or 3 scenarios for a problem. It's a very good thing to have in any position, in any work, in any country. CEDA, on the other hand, has always supported this model of sandwich PhD and also maybe sandwich postdoctoral positions, in the sense that you have the students abroad, but they are also registered in your own institution. You are dealing with a project that is very relevant to your own country, and at the same time, as you were saying, Evelyn, you are getting support from a mentorship that probably you do not have at home, but you will get otherwise. And there are other things and other aspects of a sandwich program, and being able to move outside your own country for a while. And these are the kind of gains that you cannot measure with the metrics that we have. And it's to be exposed to different ways of thinking, to different social systems, to different values, and to be able to bring the best of what you learn and you see in other countries, to be able to implement and to make innovation in your own country and in your own little society or wherever you are.